COVID-19 has disproportionately impacted racial and ethnic minorities in the U.S., including refugee and immigrant communities. These communities are being infected at higher rates, hospitalized more frequently, and dying from COVID-19 at twice the average rate. The reason for these disparities are complex and include factors such as refugees and immigrants being essential workers, language barriers, and inadequate health care. Community-based organizations, or CBOs, can help local public health departments reach refugee and immigrant communities while helping people get connected to other needed supports. IRC is a CBO with a long history of working with refugee and immigrant communities. Here are 6 promising practices related to COVID-19 based on IRC's partnership with health departments. 1. Effective work can only be done through trusting relationships. How can health departments build trust with refugee and immigrant communities during COVID-19 if an existing relationship does not exist? Identify the local organizations that serve and are trusted by refugee and immigrant communities. Explore partnering on concrete initiatives such as mobile testing and co-brand efforts to bolster trust. For example, mobile testing sites in Atlanta and Tucson display IRC logos along with the public health department's logos. 2. How can CBOs assist health departments in overcoming language barriers? Consider contracting with CBOs to increase language capacity. In Atlanta, IRC staff who speak more than 20 languages and dialects are being deployed to testing sites. 3. How can health departments improve access to testing in refugee and immigrant communities? Bring the services to the community rather than trying to bring the community to the services. IRC Atlanta and Tucson place mobile testing sites adjacent to apartment complexes with large numbers of refugee and immigrant residents. Many people may not have cars, so both drive-through and walk-up sites are available. 4. How can health departments increase the success of contact tracers calls? Use a trusted partner to communicate the need for contact tracing. IRC Boise has found more people answer contact tracers calls if they are sent videos featuring different community leaders describing contact tracing. How can health departments help those testing for COVID-19 follow isolation guidelines? Work with CBOs to develop a community referral list of basic needs and supports, like food pantries and rent and utility assistance, so that people are connected to services that help them stay home. IRC Salt Lake City partners with the health department and a local food pantry to drop off 2 weeks of food to those that test positive. How can health departments increase trust in the COVID-19 vaccine? Partner with CBOs and community leaders to communicate culturally and linguistically appropriate messages regarding the vaccine. Explore co-hosting vaccination clinics and consider placing the clinic at the CBO site. Public health and CBO partnership is essential to reducing COVID-19 health disparities in refugee and immigrant communities.